I'm not a member of this committee, but I'm stepping in for Jean O'Kenny, and thanks for letting me in. I just want to pick up on the last point first. I mean, in January, it'll be 4 years since the legislation to allow women to procure abortion in Ireland will have been enacted. And straight away in 2019, when it was passed, there were pickets and protests outside GP surgeries and doctors' clinics. And the legislation was passed in the spirit of many promises that were given. Some of them are still being enacted, like the provision of free contraception, looking at the sex education in schools, so that, you know, as a whole package, the need for intervention in crisis pregnancy will be undermined, but that crisis pregnancy will be able to be dealt with as well. So 4 years is a long time to have something that was shadowed in the legislation, the provision of safe access zones, not even been close to being passed yet. So I know this has been said by many deputies and senators here, but the question of urgency can't be overemphasised, because it won't be passed before 2023, January 2023. I'm quite sure of that, looking at what you're saying here, which means that 4 years on we don't have safe access zones, and it's very, very worrying. And again, just to repeat, as has been said, it has a chill effect on the provision of services, and we've seen this particularly in parts of the west of Ireland and the northwest of Ireland. There's accounts there of GPs pulling out of delivering the service, of being on the list of those willing to deliver, because of threats, of intimidation, of fear. There's been an account of a GP in the west of Ireland whose home was actually threatened because they lived near where they worked and they were providing the services, and the threats were all the time around them and their family, going to and from school and carrying out normal day-to-day things like shopping. So I think it's really, really important that there's a strong signal sent out, that there's an urgency about the legislation, that there's a strong signal sent out. There's a proposal of some kind of public awareness campaign of the legislation, and maybe you could talk a little bit about that. So I would emphasise that thing of urgency and trying to get, you know, a time from you, you know, from the department as to when we will see this through. There's the question of the right of confidentiality for women who will be seen by protesters going in and out, and many of them would be in abusive relations, for example, so that they need to keep their own affairs private. And this is all the time under threat when we don't have these safe access zones. The question of it providing a chill effect to the provision of services isn't just something in Ireland. It's the World Health Organization recognises this and has done research on it. So I just want to really emphasise that. And the one thing I want to ask about, that others have asked about as well, is the question of industrial relations activity. And I know you said that it's not, you can go back over the argument again, that it's not perceived to be under that particular heading, that industrial relations activity is prohibited. But sometimes industrial relation activity is unofficial and would be perceived by an employer as therefore being illegal. So I think we need to be careful about this. It would still be industrial relations activity, although albeit unofficial and perceived as being illegal. It may then fall foul of this legislation, and therefore I think we should go back to having a specific clause that excludes any kind of strike activity or protest activity by cleaners, doctors, nurses, health workers of any sort inside an abortion care setting. So I think we'll be proposing that, and we'll be trying to amend the legislation accordingly, but I'd love to see it coming from yourselves. The other thing to say is that I'm kind of baffled as to why the department didn't go along with the Shannon bill that was going through, because we would have had this much earlier had we cooperated with the bill going through with the Shannon and looking at maybe amending that or changing or adding to it rather than taking this length of time. And I am also concerned, as others have been, about the definition of curtilage and how we define that, and whether a car park or a playground nearby or whatever is included in the definition, and how protests will be controlled. Because it is true that protests don't have to be of this nature. They don't have to be in your face, all over you, shouting and roaring at you. It can just be carrying an abusive and disgraceful symbol or, picture or painting or whatever, as happened here outside the gates of the Dáil frequently during the course of the debate around the 8th Amendment. So I think we need to get much more clarity on what we're talking about here. And I've one or two more questions, but I'll come back to you.
Thank you very much, Deputy. Just on the issue of urgency, I can assure the committee of the urgency with which the Minister for Health, Mr Donnelly, regards this, and he's prioritised it in the autumn schedule. It was, you're right, Deputy, something initially intended and envisaged to be encompassed within the 2018 legislation, and I think it just ran into complexity there, and there was an imperative to progress that bill with a view to establishing the services. The chill effect is something we are deeply conscious of. It's a delicate time in the rollout of what are new services in a sense, and issues that you refer to about the geographical distribution of services and the particular chill effect that can occur in maybe rural settings. I think it's something we're very, very conscious of, and that it's a part of the intention of the bill to create a safe environment in which services can be delivered. The privacy and dignity of people, you're so right about people when they need to access medical services. It can be a very difficult and vulnerable time in their lives, and just it's so vitally important for their dignity that their privacy and their safety is protected in accessing those services. Public awareness campaign. I suppose we're so immersed in the drafting that we hadn't thought there yet, but it's actually a very, very important thing that we will do, and we'll engage colleagues from now that can help us in relation to that, and the Women's Health Division in our press and comms. We have some excellent colleagues there, so we will take that on board. Deputy, thank you. Confidentiality, like I think one of the excellent policy decisions made by the Dáil in 2018 was the incorporation of these services as part of an integrated set of primary care, GP and hospital services. We don't have the American-style abortion clinic as such as a real focal point, so that the purpose of any visit by any private individual to a health facility cannot be known. There is a confidentiality, but absolutely we don't want people, as you say, accessing those health services, legally provided health services, feeling any discomfort, distress as arising from protests in the vicinity of the services. Industrial relations activity. Our policy intent is clear there. We absolutely do not seek to undermine industrial relations activity. Take your point, and it's not always sort of official. It can be spontaneous. It can be unofficial, and we will, again, all types of industrial relations activity by any workers we will absolutely work to ensure that it's not encompassed or not undermined in any part of the country. Whether a specific clause, an exemption, we're looking at that. That might be necessary, or else the prohibited behaviours within the zone will be sort of refined to a place where they can clearly not be presumed to encompass industrial activity. But I hear your advice is get specific on an exemption in relation to it. The private members bill, just to say, we absolutely, and you could see such similarity in many ways. We're deeply grateful to Senator Gavin and all the senators and deputies that contributed to that, and you'll see it's evident that our current scheme in many respects builds on their work in the area. However, it's acknowledged that legislating the area is complex and challenging from the perspective of balancing competing constitutional rights, and I suppose all the work we're doing now is work that was always necessary with any vehicle, with any legislative vehicle. So That has helped us greatly, that private members bill, and we've built on it in the work we're doing now.
Well, just to finish, just to conclude, I'm glad that's acknowledged. But I am concerned about the repeated expression of complex and difficult legislation in this discussion and in the approach to this legislation. We're not reinventing the wheel. There are many other countries that have safe access zones. The World Health Organization has done research on them. It's not like we're taking something brand new and we have to be really, really terribly careful about it because it is so complex. It's actually not that complex. Once we get the cooperation of all of the players involved, in particular the Gardaí, it shouldn't be a complex matter. We already have, for example, laws like the Public Order Act, where Gardaí can come up and tell you, stop doing that, don't stand there, move on. And if you don't, they can arrest you with the permission of the Public Order Act. So it cannot be that complex that it has taken us so long. And I just want to finish with that comment because there's an urgency. I'll just repeat, as others have done, there is an urgency for this to come through. It sends out such a bad signal, and it is having a chilling effect on what is already a fragile service in this country, particularly in parts of rural Ireland.
Thank you, Deputy.